Diabetes. Let's make it easier for everyone. First, log the three main types: T1, T2, GDM. T1, type 1 diabetes, type 2 diabetes, gestational diabetes. Quick memory line: 1 is equal to no insulin, 2 is equal to insulin not working well, G is equal to pregnancy. Type 1 happens because the body makes little or no insulin after autoimmune destruction of the pancreatic beta cells. Type 2 is the common form linked to insulin resistance and relative insulin deficiency. Gestational diabetes develops during pregnancy. Number 2, the fastest diagnostic trick, 5-7-11 rule. A1C greater than 6.5%, fasting plasma glucose greater than 126 milligrams per deciliter, 2 hours OGTT glucose greater than 200 milligrams per deciliter, random plasma glucose greater than 200 milligrams per deciliter with classic symptoms. These are the ADA diagnostic cutoffs for diabetes. Mnemonic: 6.5, 126, 200, 200. This one line alone solves many direct MCQs. Pre-diabetes shortcut: A1C 5.7 to 6.4%, fasting 100 to 125 milligrams per deciliter, 2 hours OGTT 140 to 199 milligrams per deciliter. Mnemonic: pre-diabetes lives between normal and diabetic. Next, symptoms, the classic memory set. The easiest mnemonic: 3 P's plus tired plus thin plus blur, which is polyuria, polydipsia, polyphagia plus fatigue, weight loss, blurred vision. These are standard diabetic symptoms listed. Easy student line: sugar rises, so patient pees more, drinks more, eats more, but still loses weight. Next, type 1 versus type 2, the cleanest exam split. Type 1 often needs insulin to survive, while type 2 is the most common form and is usually managed first with lifestyle change and medication, with insulin added when needed. Diabetic ketoacidosis is classically linked to type 1 but can also occur in type 2. Mnemonic: 1 is sudden and insulin dependent, 2 is slow and resistant. Next, best ways to remember the complications. Split them into small vessel and big vessels. Microvascular: retinopathy, nephropathy, neuropathy. Mnemonic: eye, kidney, nerve. Macrovascular: coronary artery disease, stroke, peripheral arterial disease. Mnemonic: heart, brain, limb. NIDDK notes that diabetes can damage the eyes, kidney, nerves and heart over time. One line memory: small vessels give eye, kidney, nerve. Big vessels give heart, brain, leg. Acute complications: highest yield emergency areas. There are 2 big acute metabolic emergencies students must separate. Diabetic ketoacidosis, think type 1. Ketones, acidosis, dehydration. NIDDK explicitly notes that high ketones can cause diabetic ketoacidosis, and that is a medical emergency. Mnemonic: DKA is equal to ketones plus acid. HHS, think type 2. Very high glucose, hyperosmolarity, severe dehydration and no major ketoacidosis. Mnemonic: HHS, high sugar, high serum osmolarity. Easy contrast line: DKA has ketones, HHS has extreme dehydration and hyperosmolarity. Next, the easiest drug classification for the exams. The most exam-friendly way is to learn the anti-diabetic drugs by the suffix. Biguanides, metformin. Memory: metformin, the first main step. Metformin remains a classic first-line anchor in type 2 diabetes care, though modern regimes are also individualized. Sulfonylureas, glibenclamide, glicanazide, glipzinide. Memory: GLI drugs give insulin. DPP4 inhibitors: sitagliptin, vildagliptin, linagliptin. Mnemonic: gliptin. DPP4. GLP-1 receptor agonist, liraglutide, semaglutide, exenatide. Mnemonics, tide is equal to GLP-1. SGLT2 inhibitors, dapagliflozin, empagliflozin, canagliflozin. Mnemonic, flozin, flush, glucose. Insulin, always remember, rapid, short, intermediate, long acting. Students chant metformin, GLI, gliptin, tide, flozin, insulin. Next, the best way to remember insulin types: rapid acting, lispro, aspart, glulicine; short acting, regular insulin; intermediate, NPH; long acting, glargine, detamir, diglutide. Mnemonic, rapid meals, short classic; intermediate, NPH; long, basal, easy line. Rapid is for food, long is for the background. Next, the oral drug shortcut students actually need. Instead of mugging more than 50 names, say this: type 2 oral or non-insulin family tree: metformin, sulfonylureas, gliptins, flozins, GLP-1 agonist, insulin if needed. That is enough for a quick NEET revision. Next, the HbA1c trick. Mnemonic, A1c is equal to average sugar memory. HbA1c reflects longer term glycemic exposure and is one of the accepted diagnostic tests when it is 6.5% or higher. Next, gestational diabetes, the exam one-liners. CDC notes gestational diabetes usually has no obvious symptoms and screening is commonly done during pregnancy. So the easy line is, GDM is often silent but matters to the mother and the baby. High yield memory, pregnancy sugar today, type 2 risk tomorrow. A history of gestational diabetes increases later the risk of type 2 diabetes. Most common MCQ traps. Trap 1, confusing the type 1 with type 2. Fix. Type 1, insulin is absent. Type 2, insulin resistant. Trap number 2, forgetting diagnosis value. Fix. 6.5, 126, 200, 200. Trap number 3, mixing DKA and HHS. Fix. DKA, ketones plus acidosis. HHS, hyperosmolar, severe dehydration. Trap number 4, forgetting microvascular complications. Fix. Eye, kidney, nerve. Trap number 5, confusing the drug suffixes. Fix. Gliptin, tide, flozin. Next, the best oral chant for students. Say this daily. Type 1, type 2, gestational. 3 P's, fatigue, weight loss, blurred vision. Diagnosis, 6.5, 126, 200, 200. Complications, eye, kidney, nerve, heart, brain, limb. DKA has ketones. HHS has hyperosmolarity. Metformin, sulfonylureas, gliptins, CLP-1 tides, SGLT2 flozins, and insulin. Highly repeatable and exam friendly. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.